First of all, I wanted to thank everybody for being here. This is kind of ironic because there's a lot of familiar faces here, so I'm very excited to see a lot of our friends and associates that are here, and very grateful for that. So thank you so much for that. Before I started, I wanted to thank God for this opportunity to also present our program and our services. So we appreciate that very much. So before I start, I wanted to say happy birthday to Charlotte Roberts. It's Charlotte's birthday today, and just like Charlotte, she's such a giving person. She would have this kind of a day where everybody has opportunities. It's a way of her giving, and she does it on her special day as well. So true representation of how great a person she is. So thank you so much, Charlotte. I also wanted to give thanks to my wife, Ronalyn. She's sitting in the matter table. You can stand up. It's Physician Home Care Services Plus was started by Ronalyn 8 years ago. It was her idea and strategy. So I talk and she executes. So that's been part of the success of our program. Special thanks also to University of Illinois for this wonderful opportunity, Procurement Diversity Group, for setting up this wonderful event. It's really a fantastic platform for opportunities to be built, and I'll share a little bit on that as I'm going through this presentation. A little bit about myself. So previously, I was very much involved with the diversity, the Chicago Minority Business Development Council. We have Sheila Hill here, and Sheila Hill Morgan, and Phil Beretta's also here. And I knew the value of diversity, but when Ronalyn started her company, I didn't know if there was a value for us getting certified. And the reason for that was because we're Physician Home Care Services Plus. We send doctors out to see patients. We didn't know what the benefit could be with the patient's care for a certified minority-owned business or not. And the thought was, no, it was not going to be a factor, so we didn't even think about getting certified or anything. Last year, we were invited by the procurement team here, Charla and Dale, to exhibit and do a presentation at the symposium. And as we did the presentation, we were getting more opportunities and learning a lot more. But at the same time, the team here really encouraged us to go out and get certified with the state of Illinois as a minority woman-owned business. And I didn't really understand the benefits of it at that time, but we did work with the university and the team, and Charla and Dale helped us with our certification process, and we were able to get that going. Now, what was amazing about that was that, a lot of the patients in this community, or a lot of the citizens in this community, have been getting auto-enrolled into managed care organizations. So organizations like Blue Cross, Aetna, Cigna, Humana have been enrolling a lot of these patients, and we were going out there trying to get a contract from these organizations. So for the past 2 years, I was out there talking to a lot of the insurance companies about house calls or home-based primary care services. And when I would call these insurance companies, they would say, "What do you do? What is that? Do we need that? We don't use that service." So it was sort of a struggle, but at the same time, we kept diligent in trying to pursue all these opportunities. I was very fortunate after getting our minority certification. I had a chance meeting with Senator James Claiborne, who's sitting right here, who, as many of you saw throughout the day, have been getting a lot of highlights to what his efforts have been with diversity. So in that chance meeting, I was able to tell Senator Claiborne in 5 minutes what our program is, what our services are, and that it's been very challenging to get contracts with a lot of these managed care organizations. So after I spoke to him for like 5 minutes, he called me back another day, just a few days later, and he asked me to explain what we do again. And I explained to him it's about house calls, home-based primary care services, the highest quality care, the lowest cost, providing access to the patients in the community. And he said to me, "Well, who do you want to work with, Stephen? Which insurance companies?" And I said, "All the insurance companies, because we can provide a great benefit to all the members." And he said, let's pick one and go with that. And I said Blue Cross. And fortunately, he said, "Okay." So this call that I had with the senator was on Monday. And he said, "Let's go there Wednesday. We'll set up a meeting, go meet with them." And I said, "Senator, I don't have a meeting. You can't get into Blue Cross and just meet with an executive that short notice." He said, "Just meet me in the lobby. We'll get it done." So I show up in the lobby. It was a rainy, horrible day, and he's got the director of managed care, the deputy director of managed care for the state of Illinois there. He's got the medical director for Blue Cross there. He's got the lobbyist for Blue Cross there. He walks us into the conference room and says, "Stevens, tell them what you do, and we'll see what deals or opportunities there may be." We walked in, and they heard our presentation and our services, and we got a contract within a week. And when you think about that, it's like I had no idea that something that I've been trying to do for 3 years could be done within a week, but that shows what can be done. So what's incredible about that also is that as I was involved in diversity and supplier diversity and initiatives in those areas in the past, the amazing thing about was that it was initially started as a social cause, and then it became like a business case. But in our situation, it became sort of like a innovation through diversity to get to solutions. So in my presentation that I'm going to be doing, I'm going to try to run through really quick so I don't waste too much time. I'm going to share with you what the advantages and the values of our organization, our services are impacting the community. But I also want to acknowledge some of the folks from Blue Cross that are here. Rex McCulley, he's a case manager overseeing over 5 million members for Blue Cross. We got Yvonne Sostan here. These are wonderful individuals who've been advocating and supporting our initiatives. We see that more often than not when we're out there talking about our services. It's usually the social workers that really understand the value because they're engaging these patients that are needing our services and our support. So we'll start with the presentation. And so the presentation is called House Calls, the Value-Based Care Solution. So Physician Home Care Services Plus provides medical house call services by physicians, nurse practitioners, and physician assistants directly to the patient's homes. We can assume a primary care role or work as an intermittent solution, such as a visiting hospitalist, to support home-limited patients medically, functionally, and psychosocially. Our services provide and deliver an answer to meet optimal measurable goals for the healthcare systems. We provide comprehensive, compassionate, evidence-based care, incorporating best-in-class processes, standards, and technologies for the communities we serve. A little bit more about our organization in particular. We service over 10,000 patients in 10 counties. How we've done that is without marketing, and word of mouth actually is how we really grew our program. We have compassionate doctors who want to serve an underserved community, and so they do that, and we have a well-organized system. Caring and experienced, accomplished physician leadership is a big factor. We do 24/7 case management of patients by physicians. We do over 1,000 home visits on a monthly basis. We use a #1 rated EMR called Athena. It's electronic medical records. We use an iPad. All of our doctors go out with an iPad with 4G services. Best practice used for all patients, fully implemented compliance, quality assurance, performance improvement standards, infection prevention strategies, control plans for care utilization. And we've been servicing Illinois families since 2007, and thanks to the University of Illinois, we're also certified as a BEP organization, Business Enterprise Program, minority woman-owned. A little bit on the next slide about our doctor. Dr. Teresa Matsura is our medical director. She's been practicing medicine for over 28 years. She's a respected cardiologist, internal medicine, critical care, 13 successful clinical research projects, Internist of the Year 2009, American College of Internists, Teacher of the Year, CCOM class in 1996, Midwestern University. And she's leading our program in population health strategies for all of our doctors in our program. We can go to the next sheet, next slide, I'm sorry. And some of the organizations that we partner with to make sure that we have a high quality program. So we partner with Telegen, the Quality Improvement Organization for Medicare and Medicare Services. They pull all of our data, make sure our doctors are doing the very best for the patients we serve. We're partnering with Blue Cross on a lot of major initiatives, the state of Illinois, American Academy of Home Care Medicine. We do collaborations with hospitals, including the University of Illinois, to teach organizations on how to do house calls. And University of Illinois just launched their program this year, and it's doing really well. Athena, Rosalind Franklin University, we do preceptors where a lot of the physician assistant students are going out with our doctors to learn more about house calls. We work with Age Options, Health and Medicine Policy Research Group, Illinois Continuity Care Association. We can go to the next slide here. So a little bit about population health. As many of you know, healthcare is a major issue. Everybody's scrambling, trying to figure out what's going on, how everything's going to evolve. So part of the challenge is the cost for healthcare and how do we contain it. So if we look at the population right now, 2010 was supposed to be 19 million people over the age of 65. 2020 was supposed to be by 2020 it's going to be 66 million. 2030 is going to be 73 million, which is 19% of the US population. So when you look at the Medicare budget, you know, everybody's talking about healthcare costs, healthcare issues, all these changes that are happening. The 2016 Medicare budget is $672 billion. And out of the $672 billion, 5% of the patients in the community are taking more than half of that cost. So when you look at our services and who we're supporting, it's that 5% of the citizens of this country. If we can contain those costs, then I think we're going to be really ahead. If you look at the top 1%, the median cost is almost $100,000 a year of the patients that are high acuity. We can go to the next slide. So some of the changes that are happening in healthcare, there's a 3-year payment reform timeline. Alternative payment models, you know, Medicare payments through alternative payment models to increase from current 20% level to 30% by the end of 2016 and 50% by 2018. Medicare payments are linked to quality and value to reach 85% by 2016 and 90% by 2018. The factors are going to be hospital readmission reduction and hospital value-based purchasing. So there's a lot of changes that are coming and going on right now. So you can go to the next slide. So a little bit about comparisons of when you're looking at home-based primary care, what are the advantages? So there's an accountable care organization called OSF that just did a presentation a couple of weeks ago at the Illinois Home Care Conference, and they are part of the Rockford Memorial System. So they have 48,000 lives in their ACO initiative. On the first year and second year, they didn't make any money. They didn't show any savings. On the third year, they did. On the third year, they had a savings of $12 million in the third year. And that equals to around $125 per member through shared savings, which sounds like a decent number, but not really for 48,000 lives. So there was another study that was done called Independence at Home. And what they did was they took 8,000 high acuity patients and assigned them to 17 practices and said, can you reduce the cost of these patients? And of the 17 practices that were selected, 9 were successful in meeting all these goals. And what did they save? $25 million on 8,000 lives, equal to $3,125 per member per shared savings. So comprehensive chronic care management through a house calls model has the ability to save as much as $700 per month in savings for those high acuity patients. So those are the folks that we're trying to care for with our services. It's about providing access. It's about home limited patients that need access to care, eliminating the barriers that are there for these patients. Thank you. For fee for service versus shared savings, so a lot of hospitals and health systems are trying to figure out what they can do and how they can be a part of the shared savings. We have to ask, what is the plan? What is the goal? 80% of the hospitals in this country are losing money right now. And by 2018, none of them are going to be profitable. The only way they're going to make profits is through shared savings. So whatever they can save, then they're going to make money off of that. So it's all about risk stratification and access to care, highest quality care. The next slide. We created a LACE tool that identifies the patients that are high risk for rehospitalization, age 75 or older, 3 or more active health conditions, 2 or more falls in the last 3 months, low health literacy, functional deficits requiring PT and/or OT, 5 or more prescribed medications, inadequate support systems, incontinence, shortness of breath, history of noncompliance, 2 or more hospitalizations in the last 12 months, weight loss, reported self-exhaustion, slower movements to sit, stand while walking, cognitive impairment or recent decline in mental, emotional, or behavioral status such as dementia. So this is the aging America. This is the population we want to help. Can we go to the next slide? So some of our advantages that we offer, all home limited patients have access to quality medical care. timely access to physicians in the home within 24 to 48 hours. Many of you have family members that are aging, and you know the struggle sometimes to get them to the doctor. Imagine the doctor coming to see them within 24 to 48 hours. Timely and accurate processing of all documentation, patient-centered, value, and quality-based healthcare. If you see a lot of hospitals now, when you go see doctors in the clinic, they're overwhelmed. They're being asked to see as many as 35, 40 patients in a day. So once they're talking about one pain in the one part of their body, they can't even explain the other. So our doctors, when they go out there, they are able to spend time with the patients and help them really with their issues. Reduced length of hospital stay is what we can also do. There's a lot of studies, verifiable data on that. Reduced cost of care, spending per beneficiary, reducing nursing home stays, increased patient experience, help lead population health, medical in-homes chronic care management initiatives, case management of patients, and post-acute care providers outside the walls of the hospital utilizing high-quality, low-cost best solutions. For the next sheet, we just created a pathway where we identify the patients, and from there, if our doctors identify 5 components of the characteristics that are high risk, from there, our doctors can make evaluations on what are the best practices. So I don't want to bore you with that. The next sheet, it talks a little bit about how our solution is based on containing the post-acute care costs. In the state of Illinois, we have the highest per capita spending for post-acute care cost needs. So, the doctors can control the utilization with their pen. And so, that's part of the way the savings is going to be coming for the future. Next sheet covers 11 counties that we service right now. And we're continuing to expand and do more. And we can go to the next slide as well. One of the new initiatives that we're working on, the one before that. Oh, there you go. So right now, one of the things that we're doing also is we're working on some legislative initiatives. We're going to be working with the senator and other state leaders to create a new legislation that's going to, allow the payer, the insurance companies, to put out a letter to all home limited patients that they have access to house call service by physician. We're going to base it possibly on a DON score of 29 or higher. And so this way, these patients who are home limited will know that they have access to this federal benefit, which is house calls. Because the way we look at it, it's sort of a technicality. These patients are selecting a doctor that they may not even see when they have the book given to them with all the doctors that can address and take care of them. But the reality is, for the homebound and home limited patients, they need a visiting physician, and that's what the solution is going forward. So we believe if this legislation passes, it's going to go from the state of Illinois to the national level, and it's going to change a lot of things in this country. Next slide. Our special thanks to the University of Illinois and Office of Procurement Diversity. Special thanks to Mike Bass, Mr. Walter Noer, President Timothy Killen, Charlotte Roberts, Dale Morrison, and Vernell for the opportunity to present our services, our program. And thank you so much for being here. Appreciate your time and efforts. Thank you.
Okay. Thank you, Mr. Stephen. And we also have an award for you, our Spotlight Award for your outstanding service to, to the university and other agencies within the area. So.